Yasco and Paula, what else can we say besides being great friends of us here in the Spiritist Society of Baltimore, but also to say that every time we come together, as many of us here, it's that feeling like we have to study more, we have to be better people, because they are good individuals, because there are individuals that when we talk is that excitement of talking to someone who can share something new that perhaps we haven't accomplished yet, good habits, good feelings, right, the good vibration, and this persistence. So we thank you, and we pass the words to Paula first. Okay.
But I don't need that. I'm
No.
okay.
No, that's fine.
Okay. Welcome to this beautiful start of spring, despite the fact I came out of a snowy woods to get here. Not yet, but it's okay. I can still talk without it. I thought it was interesting with the opening selection that in essence, what we don't learn out of love, we learn through pain. And it's a rare person going through an earthly experience who doesn't have to deal with some type of mental and/or physical pain. So it seems like the topic of healing is ongoing. And that's why we're here today, to review it one more time. We have to start with our acknowledgement to Western medicine, because we see it continuing to evolve. It's our treatment of choice when we have an accident or a serious illness. And we know now with updated imaging techniques, they're getting better and better at pinpointing the sources of our troubles. But we don't think that's the whole picture when it comes to healing. We just are thankful we have Western medicine, but I think it's helpful to learn there are other things we can do. And we will now go on to the integrative. Okay, now our definitions first. In order to integrate Western medicine or allopathic with other techniques, we incorporate beliefs that we hold as spiritists, that a valuable contribution to wellness is spiritual awareness and also spiritual healing practices. But this was an interesting definition I found on the root of where holistic healing comes from. And holistic was like the previous slide. It was mind, body, and spirit. They're always intertwined. They're always interacting. Western medicine originally separated mind and body and was heavily focused on the body. Now they're getting the integration with the mind, thank goodness, and we're going to spend a little more time with that. But to truly be holistic focuses on the positive connection to the spirit in the stillness or in the space between your thoughts, mediated by the pineal gland. And we've learned in Spiritism that the pineal gland seems to be our connector to God spot. Our spiritual intelligence resides there. And there really is a still point between your thoughts, which is really hard for us to even imagine sometimes, because basically we're thinking, and we're doing, and we're busy, and we're at work, or we're with family, and we're always figuring out something. And then the only time we think our thoughts stop are when we fall asleep. But that's not true. We're gaining in our awareness that if we can learn some practices and try to get to that place between our thoughts, we actually can spend a few moments there, and it will build through the practices we continue to do, which is what we're going to talk about today. Okay. How many people are familiar with Dr. Andrew Weil? Good. He was someone I called the PBS doctor, especially like 10 years ago, because he was the first one to coin this term of integrative medicine, which to me is common sense. That we have all our Western techniques, we understand about surgeries, we know about getting prescriptions, but we also have this long tradition of holistic healing. If you go back to the roots of a lot of cultures, they had herbal healers, they had spiritual healers. So wouldn't it make sense that we would combine the two? So that's what Dr. Weil did out in Arizona. He started the first training program for integrative medicine. And when he graduated his doctors out there by Tucson, he didn't want them just to open up a general practice. He wanted them to go into medical faculties and have positions of influence so the seed could keep spreading. And that is indeed what he's accomplished, and he's still working on it. Because I would think the physician in the future would be trained in everything and would be able to help the patient prioritize their treatment. If you're in extreme need, use your Western medicine. If it's something that could be treated just as effectively with a less toxic substance, like some type of homeopathy or herb instead of an antibiotic, it might take a little longer, but you'd still be able to heal it. Then that person would help guide the patient in making the decision. Europe is further along than we are. One of my times I visited Germany and Switzerland, they're much more integrated than we are. I think we're going to get there, and part of it is going to be that we have conversations with our doctors and ask about it. Yeah, first we have a problem. These were the latest statistics we could find from alternative medicine, the statistics they had available online. So in 2007, these were the most frequent conditions that adults in the USA wanted to do something different from Western medicine. It's interesting, the first big one is back pain, which seems to be a condition of getting to midlife for a lot of people. And it was really what took me to Brazil 12 years ago when I was struggling with significant back pain, which is how I went to John of God, which is how I learned about Spiritism. So I have to thank back pain for opening me up.
It served for a good purpose, right?
Yeah, and I fortunately don't have it like I did when I went to Brazil. And so that was also my introduction to the spiritual level of healing, because it turned out what I really needed underneath my back pain was to experience unconditional love in my heart. And with that experience, it was amazing how things changed and melted. But if you just go through here, you can see what Americans are now using routinely. Okay, next one. So what do Americans go to first? Well, here you go. It's like Vitamin Shop. And they have given us a warning that just because you're in GNC or Target, you shouldn't automatically purchase an herbal product. You really need to buy certified, reputable brands and do some of your own homework. But it seems like natural products, and look what's second, breathing, which is free. It's just learning some techniques to do that deep breath, because you can't be worried and upset and be doing a deep breath. Your breathing gets shallower and more rapid. So that's amazing how simple that is. Meditation, chiropractic, and osteopathic have really come into their own. Before, people with back pain went right to a doctor, might have gotten a prescription, told to rest, maybe get to a physical therapist, which is good now. But really, these people are coming into their own. And an osteopath is a fully trained doctor, if you're not familiar with osteopathic medicine. Massage, yoga, diet-based therapies, they're getting much more familiar. What with grain brain and wheat belly, and people starting to question what's in their foods and getting away from processed foods back to more natural home-cooked foods. And I was just in California for a week, and they really are putting through some guidelines that's going to call processed white sugar a toxic substance. Because so much of what we're doing is really education. Once you're educated, you can make a choice what you want to do with keeping yourself well, but the first step is to educate. And then we have progressive relaxation. Guided imagery we use here in the center, and our CD on health is guided imagery. And sometimes when we end a meeting and there's a guided prayer, that is guided imagery. And that was actually the first form of meditation I ever tried, because it's really quite easy. You have a voice that's taking you on a journey and you're getting relaxed. The main point is to get relaxed. And then you can go on to more mindfulness techniques. And then the last one, of course, is homeopathy. How many people here have ever used homeopathy? Okay, I think it's growing. Again, it's better known in Europe, but we'll get there. Okay. For this scale of remedies, I decided I would do show and tell. I spent 32 years primarily in elementary education. So I think I learn better if I can see something. But this scale, let's go from bottom to top. We all know what this is. I mean, it probably isn't one person in here who's not received a prescription from a doctor. Where? Say what?
Verbally.
Oh, right here, because people can't read it?
Yeah.
Okay. The first level is a pharmaceutical drug, and it works on the basic physical level, but there are toxic physical and subtle side effects. And we know with certain medical conditions, the more prescriptions you're taking, you really have to take a look at the interaction of side effects. I mean, we're not making a judgment. They're necessary and needed, but you also have to balance out the side effects. So a lot of times when I talk to people with cancer, they're doing a regular Western treatment, but they've really changed their diet. Or they're using homeopathy or some other things to mitigate side effects. Then we come up to herbal medicine. And here's my show and tell. I brought along an herbal throat spray that I got from my osteopathic doctor. So you can do all kinds of things to make your throat better if it's scratchy, but herbs can be delivered in a spray bottle or you can make a tea. And I'm sure everyone has some herbal tea in their kitchen by now, if it's not chamomile or lavender or something. Now we come up to aromatherapy. What we're doing here is we're going from the strongest impact on the body up to the gentlest, but we're also moving through what we would call different levels of energy. If you think quantum physics, and we've all learned that we're all just vibrating molecules, so to speak, everything is also vibrating. So when you're out of balance because you have gotten sick or you're really mentally stressed, what you need to do is come back into balance. And these are the substances that can help balance you back. So aromatherapy, again, here's a spray. Somebody will get it in the front row. This is lemon rose. And lemon's a really good one, especially when you're working in an office, to increase your concentration and reduce your errors, and also help you not be fatigued. Yeah.
We're not gonna be fatigued.
Now, they did that research in an office in Japan years ago, and if a citrus smell was in the room, that people were much more alert and made fewer errors. Homeopathy, which some people have used, I brought along Arnica montana, because if you want to start with something, this is for muscle aches and pains, even if you shoveled snow or your gardening was too enthusiastic. And what you do is you just open up the vial, you put 5 little pellets, and then you put it under your tongue. You don't want it to touch anything. There's a vibration in this medicine, so you want to keep it pure. Then what are we up to next? Gemstones. How many people have even thought that gemstones were healing? How would you say they're healing?
It depends.
Or just
The stone and the illness.
right.
That's all I know of basic.
Okay. Well, gems also have a vibrational pattern. So the easiest one that I brought along was rose quartz, because it works on the heart. And the heart is really at the root of a lot of things that we are having difficulty with, when we're stressed especially. So rose quartz is the calmer. You can also make an elixir. If you have a nice clean crystal or gemstone, if you drop it in water and let it sit there for a while, the energy goes into the water and you can drink it. It's researched, I didn't make it up. And the last one are flower essences. Flower essences I love because they work on emotional, psychological, and spiritual energy levels. Has Now, I guess just to check on people, does anyone here regularly use rescue remedy for emergencies? Okay, well that's where you start. And they're so clever now, the British. They have now put rescue remedy into a little pastel candy. They also have it in its traditional form, which are drops. And there's even chewing gum. And you can buy this pretty easily now, like in a Wegmans in the natural food section, or Mom's if you shop in Mom's. So this is the one I would start with if you're really unfamiliar with flower essences. But flower essences are so universal. And I use them a lot with children in my own private practice because they address children's common needs, be that anxiety, having trouble sleeping, a learning problem, difficulty with friends, or just expressing themselves. So you can easily go online and teach yourself about the Bach flower essences, but I would say start with this one because it's easy. And I just keep it in my purse. It could be something as small as being stuck in traffic to something worse, like you just got bad news on a loved one. But if you take rescue remedy, it's really subtle, but you'll feel like you're being protected and held. That's the best way I can describe it. Is the next one me still or you?
Yeah.
This is my last one, right?
So, yeah.
Yeah. This one, Yasco found this quote, but it works perfectly when we're looking at the emotions that are tied with any kind of healing situation. So this was just for us to read. Feelings of anger, despair, cruelty, and intemperance create morbid zones in one's organic structure. So all of a sudden, whoops, here I have a body, it's organic, but my state of mind connected in with the feelings I'm going through, everything's having an effect. They cause a state of dissonance in the cells, which neutralizes nearly all their defense mechanisms and renders the weaker organs a fertile ground for pathological germs. So now we're wondering how the germs thrive, and we might not even know we're that upset with somebody, or we're really not forgiving somebody. But it has to be dealt with. Otherwise, it's going to wind up on the cellular level, which can be a surprise to a lot of people. That is why tuberculosis, cancer, leprosy, and I can't read that fast, and ulcers are many times secondary phenomena caused by the imbalance of the mental reflexes of one's thoughts, which is why, of course, I'm wearing happy thoughts. Every strong emotion that reaches the body, this is really powerful, is like a hammer blow on a sensitive machine. When there is an inner conflict, most of the times the salivary glands cease their flow of secretion, the stomach becomes spasmodic and refuses to produce choleric acid, that then results in a digestive malfunction manifesting as mucus. And how many people have not had some kind of stomach upset in the last 6 months? The first stage often opens the door to serious organic disorders. The abnormal state of the gastrointestinal system, if recurrent, will damage the nutritional process that in turn affects the nervous system and results in extreme mental imbalance. It reminds me of that children's song, you know, the knee bone's connected to the leg bone. But now we've really got to see the full root. And you know, even if we think of folklore, when we have a stomach upset, we can think, I can't stomach something. And all of a sudden you're churning acids and the stress goes there and then your nutrition's off. So this isn't to scare anybody, it's just to enlighten them that everything's responding to whatever you're going through. Your turn?
Okay. In Brazil, in Brazil, this lady called Marlene Nobre is really ahead of a big group in Brazil that tries to put now the spiritist view of health together with other more Western, because she is a physician and I think she is a gynecologist, so she knows how to treat the Western medicine through the But now she knows, really pioneering the Spiritists. So she wrote these books and many other books, which she says she presented a Spiritist medical model in which consciousness and the spirit underlie all physical realities. So she says we cannot separate any longer the body from the mind, from the spirits. So she's focusing this. So the patient is encouraged to self-knowledge. So knowledge is key. Once you know, you pay attention. You become more responsible. So, not because all healing at any level, organic, psychological, mental, spiritual, in fact, is a self-healing. The doctor and the medium, when the guys come to Spirit Center thinking the medium or somebody's going to heal, no. It's the person that's going to heal. Jesus already said, it's not me that's healing you. It's you. It's your faith. So it's the same way. So doctor and mediums are mere instruments, tools. So these are papers published in scientific literature, because in Brazil some hospitals are already using or combining the Western medicine with the Spiritist practice. So they put together the passes that we say, the laying down of the hands, the prayer, the fluidified, magnetized fluid water that we also distribute here. You know, charity, all what Spiritism says is positive. You have to have a positive and virtuous life. We cannot be poisoned with negative feelings, with negative thoughts. So, and have this, what we call spirit release therapy. So they apply this in the hospitals and the clinics. So it's pioneering, they're pioneering this integrative medicine, but now with the Spiritists. And Vanessa also, very recently, she said, she talked in the 3rd symposium, Spiritist Symposium, about how the disease actually is not the body itself, but it coming from the spirit through the perispirit, which then expresses in the body. So the body is almost a dumping, how to say, buckets. When the spirit cannot any longer, or the perispirit to get, it dumps and appears the disease. So first we have to clear up, cleansing our spirit and perispirit, and then our body as a consequence will be healed. Of course, like Paula said, in an emergency, if I have an infectious disease, you have to treat because with heavy antibiotics or surgery. But also we have to help the medication and the surgery with our own healing contribution. We have to do our part. We cannot just say, well, I take 10 pills and I keep sitting here waiting for me to lose weight. No, I have to do good diet. I have to do exercise, good thought. So our part is necessary. So this is another also paper that they try now to see mental disease, mental disorder, not like, oh, it's a part of the brain that has some degeneration, some dopamine neurons that are damaged or something. Schizophrenia, Parkinson is a lack of dopamine, schizophrenia, it's too much dopamine. No, it's not only that any longer, because we know that the medications are not that good. It doesn't really treat 100%, and also causes, like Paula said, side effects. So they are now combining what the Spiritists say, that many mental disorders has this component. It's not 100%, but has the component of the spiritual spirit nature. Some obsessors from the past I'm attracting by my bad behavior or bad thought or things from the past. Some obsessors that want me not to feel well. They don't want me to feel well if they are my enemy. So we have to think about them and ask help for them too. And this is another, is in a hospital that Paula wants to visit. When she goes to Brazil, she wants to visit. It's actually a psychiatric hospitals that treat with this spiritual and spiritist complementary therapy. You know, like I said, water, magnetized water, lectures about obsession for people to understand. You know, in order for you to detach from the obsessor, you have to be in a higher frequency. If you stay in the lower frequency, you're going to tune like a radio dial. You're going to tune there with the lowest, so you have to raise your bar. So very recently, this gentleman is called Bruce Lipton. Everybody probably read something about him. This book became very famous, Biology of Belief. He called Biology of Belief because he, as a professional, before he became more holistic, he was a very skeptical, as many scientists are, of this other component, spiritual component, mental component. So he was a cell biologist. He was studying cell and stem cells. So he would put in the Petri dish, very scientifically dosing what kind of factors he's going to put in the Petri dish and say, well, I want to create a muscle cell, or I want to create a bone cell, or I want to create a fat cell. And he could make this in the Petri dish. Because if you know, our cells has exactly the same genetic code. The genes are the same in all our 35 trillion cells. There is no difference. So we ask how I have the muscle cell that has a specific function as compared to heart cell, as compared to brain cells, as compared to digestive, stomach cell. There are factors that will say, now I'm going to do for you to be a muscle cell with all the function, with all the structure. So the factors, as God is so, that's why creation is wonderful. Because imagine you have the same thing and now you diverge in 35 trillion cells? Wow. So this guy called Biology of Belief because now he put into the play, the power of your belief, the power of your thoughts. It's not any longer, oh, I don't care, I go to my doctor, and he better give me some medicine and fix me tomorrow. No, not any longer. So this dogma that's called Crick. Crick is one of the guy, Watson Crick, the one that discovered the structure of DNA, which is the main structure of our gene. So that was in 1953, and he won even a Nobel Prize in 1962. He says, the dogma was, your life is controlled by genes. And this is taught in medical school even up to now. Even up to now, they say, whatever you have in your genes, forget it, it's tough luck. You're born with that. If you want, you blame your mother, you blame your father, but sorry. So the the central dogma, which we teach in the school, is that DNA has to make a RNA, this is science, in order to have the proteins that are the building block of our body. Everything is made with protein, different proteins. So this is the central dogma. So if he says, well, if this is in the nucleus, I'm going to say, so the nucleus is my life. If I remove the nucleus, I'll die, right? If my life is controlled by genes, my life is controlled by the nucleus where these things is located. No, he worked in his lab before he knew about the spiritual and power of the belief, that he could remove all the nucleus. It's called denucleation, and the cell would keep living. They were there, happy, provide that they put these factors, growth factors there. So it's not the gene, it's not the nucleus, the main cause or the main support for my life. It's not, it's wrong. So now comes the epigenetics. Is a new science in the last 10 years. Is getting very famous now in the medical schools we are teaching, which they say, no, God is much smarter to make us. They're going to say, you may be born with this genetic code from your mom, from your father, and the spiritists say, well, from your past, life, the people that is playing in my reincarnation is getting the best genetic plan for me. So no, but now you are the one that can control if you're gonna let that gene be expressed or not. So okay, you did something wrong in the past life, so in order for you to know, you may have higher probability to contract a disease, certain disease that will affect say your lung. No, but depends on your will. If it's not that bad, your commitment from the past, you can have your lifestyle fixed from the beginning, be respectful to your body, physical body, and prevent that gene to be expressed, although you carry cancer. Oh, I have higher probability to contract a cancer because for some reason I need to endure this kind of disease. However, if I know that stress, it can be a big factor, depression can be a big factor, low self-esteem can be a big factor, swallowing all the bad things that happens around you without solving the problem is a big factor because, you think, accepting everything that people do around, like we say, swallow a frog, we say in Brazil, you're going to be intoxicated from inside out. So if you know all these factors, it can put you more in higher probability to express that gene for cancer. If you don't care, you may allow. But if you care that everything now, everybody is knowing that is important, then you can prevent that thing to be expressed. Or if it comes, for you to be more prepared for the healing, to help the Western therapy with that. So there is this regulatory protein control over this gene. So that's called epi because it means over the genes, over the genetics. So that was interesting because the scientists, sometimes we are completely arrogant, very arrogant. So Up to this epigenetic came in 10 years ago or 15 years ago, we knew the chromosome had 50% proteins and 50% DNA. But we said we don't care. Once they said the gene is DNA, they said, oh, throw away this protein. We're not going to study. That's what we did. And only now we say, God won't put something 50% there with no function. It seems so crazy. Even for human beings like us, that lack of some wisdom, to put something not be useful, that seems our arrogance, right? To decide that God would waste. What's that? So now they find that, yes, this protein has some very key role, is to control the gene. So, and who controls the protein? Who will say this protein go there and tell the gene to be expressed? Environmental signals. That is what I can control. I can let my environmental signals to go there or not. Now I am not any longer victim of my genes, but I am a master. Wow, right? So this is the epigenetics. So the epigenetics means control above the genes, and they change the readout of the genes, and last, or the main thing is genes do not control your life. So the central dogma is wrong. Good for us. So Bruce Lipton asked in his book, what if, this what if, he says, is very important for you to always ask in your life. What if your mind was the master controller of your body? What if you were no longer victim of your genetic makeup, but your environment had the ability to change your genetic DNA? How about that? Wow. He says, all organisms, including humans, communicate to each other and read the environment through the energy fields. And thoughts being the energy of mind, directly influence the way the physical brain controls the body physiology. You won't believe how thought is powerful. Don't even imagine, because you're going to be so afraid to have certain thoughts, you know. Oh my God, yeah. Be careful. It's a high energy because it's non-stop. If you say, how many thoughts I have in this last 30 seconds, you won't believe. It's non-stop. You're always thinking, without automatically. Automatically, you're not conscious. Okay, so how, this is a little bit science, how it controls the protein, that regulatory protein controls. So the gene, usually, the gene is kind of, there is a little reddish gene that is an example of gene to be expressed or not. But look, there is this protein that packs this gene so tightly that there is no way for this DNA to be activated. It's kind of covered. It's covered here in between very tightly. But if comes some environmental signal and binds, like here in this histone, this thing stretches, it's not packed anymore, and that gene that was here is because it's the light, I cannot see the red, but it's here, now becomes accessible to be active, to be read. So I'm changing the readout. I'm changing if I'm going to read that gene and activate or not. And who changed this our environment. It depends on if this gene was supposed to be silent, so I don't have cancer. If something I do bad, it may come out and I have cancer. So I have to see what kind of environmental diet, whatever, it can again silence that gene again. Or vice versa, sometimes I'm supposed to activate in order to be healthy. So I have to see what environmental signal is important to activate, to do that thing and unveil the gene, that part to be activated. Otherwise, it's going to be secluded. This is a very smart way for God to be very economical, you know. With one thing, little thing, oh, it's the same thing, but depends on the environmental signal, yes or no. No or yes. Wow. You're going to be rich if you do something in your company as economical, as profitable as this, you know. So Spiritism also is treating about this epigenetics. So I help to translate this chapter, this article in this book, Health of the Soul, which is a Brazilian magazine, but now the Society of Spirits Medical Society in the United States is translate some of these articles. So they asked me to translate this article. It's called The End of the Dictatorship of the Genes. It was a dictatorship before because we were ignorant. It was always there, not this, you know, the wisdom was there, the democracy was there, just that I let be ruled by this dictator, you know, ignoring what I can do to change this. So they say we are responsible for the choices we make and which will reflect in our future existence. Not only I'm changing to this, but the fact that I'm avoiding or I'm diminishing the severity of my cancer, but I'm fixing myself to the next existence. I am more wise, I'm wiser. I know more. I know how to behave. So the Spiritist doctrine tells us that we are unique and individualized consciousness in the universe, possessing own will. That's why it's important, our own will, which is the maximum expression of free will. However, we are responsible for the consequence generated by the choices we made that will reflect our future lives following the principles of law of cause and effect, moral law. So everything has consequence. What we do has an effect. Law of cause and effect. Every day, in every way possible, you help to determine which genes will be activated or not is in our hands. So if you go back before even the genes were structured by Watson Crick, in this wonderful book, Evolution in Two Worlds, by Francisco Cândido Xavier and Emmanuel, he already said, you know, that the human mind controls almost fully the body in which it expresses by coordinating its own impulses over the cytoplasm albuminoid, which is the protein element. So it's not the nucleus. Who knows cells? Is the cytoplasm, which has the control. Actually, it's the membrane of the cell that has antennas and send the signal to inside. Bioforce, which is energy, bioenergy, like photons, you know, this is a of psychosomatic force acts in the cytoplasm, project onto the cells, and on the body, the mental states of the spirit, according to the good or evil choices. In this book also, The Consoler, Emmanuel and Francisco Cândido Xavier, the laws of genetics are governed by psychic agents, and that genetic combination depend on the achievements, trial, and the evolutionary position of the incarnate spirits. 10% of the disease is only genetically coded or of genetic contribution. The rest, they didn't know why. Sometimes out of 100, only 10 will have the disease with the same gene for cancer. Why the other 90 didn't have, right? Very quickly, so now we have what is called for self-empowerment, the behavior of epigenetics, how nurture shapes nature. Nurturing, diet, cuddling, embracing, loving, all these things, good environment will shape your nature, will change your nature. Your physiology will change your body. Environment, lifestyle, nutritional factors. Now, placebo and nocebo. Everybody knows about placebo effect, right? That the doctors or the experimenter treat you, say, I'm going to give a wonderful new medication, just released. It still is in the test. You're going to be good. It's state of art. And the other one, you don't say anything. Or you say the same thing. You can say the same thing. But to you, they give just a fake pill. For her, they give the correct one. Guess what? You have the same response as her. Because you believed that you were receiving the best medication. That is placebo effect. But has the nocebo effect, which is the opposite. If someone say, this is garbage, you're going to feel so bad if you drink this. You're going to have a stomachache, you're going to have a diarrhea, you're going to have blah, blah. Or you start to feel that. Even if they give you a fake pill. We know that, We always say, wow, I put this in my mind, And then, who knows that we have stem cells in our body? We all have stem cells because we are constantly regenerating our body. Some tissue more faster than the other. So if I have my own, it doesn't need to go to embryo. I have my own stem cell. The trick is how is my faith to boost, or like he likes the word boost, my own stem cells. How that? To help to regenerate my sick tissue. If my heart has some few cells that is already getting, has some damage and then is giving this abnormal, EKG, how about if I put some, good thoughts and boost my own stem cell to regenerate that focus, So just as environmental signals change the blood composition, right? Everything that I put in my body first has to go through my blood. Which, for instance, the brain. The brain, once reach the brain, depends on your perception. You can eat the same thing, but if you are negative, you think that thing won't help, and you think it will help, your perception will have a different result than this one, than hers, right? So that would also say to my mind, oh, that will be good because I did do good. I am eating well, I'm in this harmonious place, I decide to decrease my stress, not be upset with people. So mind also interacts with this. And I will interpret this in my way. If I have a twin sister, she's going to be different because her experience is different. So she's going to interpret this in a different way. So then to the body, that thing that came from here will go to the whole body, will release all the neurochemical hormones. There is hormones for happiness, hormones for compassion, hormones for love, you know, oxytocin, dopamine, serotonin, whatever. Also for fear, depression, fear, you know, corticoid, cortisol, adrenaline, oh, fear, horrible stomach ache because of this fear. So this goes to 37 trillion cells. This hormone, this bathing hormonal thing will bathe 37.2 trillion cells. Imagine how powerful this chain is. And will change the behavior. The behavior here is my physiological output. What if my blood pressure is going to be up or down? If my diabetes is going to be worse? Pain, back pain. My immune system is going to be boosted or down. Cancer susceptibility, infection susceptibility. My mood. Who knows about? Everybody knows about mood, right? We change. Mental disorders, etc. But above all this, we spiritists think who coordinate is the spirit. We are, after all, spirit, immortal spirit for many incarnations. So we have to acknowledge this in order to fix, to have different perception. It to send different things to the mind, and the mind send different things to the whole body. So before I give to Paula, so what you have? Exercise. Oh, growth factor. This is a very famous growth factor. Many scientists work with that. It binds to the membrane and changes epigenetically everything. Environment, clean air, water, soil, oh, we are all worried now about. No smoking, nutritional factors. Should I go to this diet, not to the other diet? What is that? You know, calorie restriction, emotional health, meditation, some spirituality, understanding me as a spirit. And all this, what I do to these trillions of cells, will have anti-inflammatory, antioxidant, anti-mutation effect. In our days, all this chronic disease, diabetes, Alzheimer's disease, hypertension, chronic hypertension, cancer, they're all related to inflammation, decrease in our immune response. We are depressing our own capability to defend ourselves. So we get infection, we get cancer, our diabetes, if we don't care about it, it's gonna be worse. So my part is, so now comes to, sorry, I think we can.
We'll work with the time we have, but thank you. Now I know more science than I ever anticipated. What I'm going to do when I just do these next couple slides is to start these papers going around, because we figured at this point you needed to participate. So we're going to, everyone just take one of these, and then we'll send the pencils or writing instruments around too. However you want to. I just wanted to facilitate that so we don't have to stop and do it. But now we're a slide ahead. What? Yeah. This is really going to be like the cliff notes to psychological theory, because we keep talking a lot. They're all the same. I made 30 copies. I was ambitious. So we keep talking about our thoughts. And this is to show you how complicated your mind is. Not that you need to know exactly where everything is, but two of the great psychological thinkers that have not really gone totally out of style were Freud and Jung. We tend to really like Jung even the most because he included the spiritual level. But Freud was a great detective. And what we're saying here is we have to reprogram our subconscious mind. Well, we don't know what's in our subconscious mind. That's why it's called subconscious. Like in the beginning, I'm all unconscious. Right, like I'm all for it. How do I change it? But I don't even know what's in there. So the conscious level is what you could have a conversation with your best friend about. That's your thoughts about things, you know, how you perceived an event. And you might have a different perception than the person sitting next to you, but it's all conscious. Then we start to dive into the iceberg. In your subconscious or preconscious level are memories and stored knowledge. Psychoanalysts really believe that from the moment you're conceived all the way through the birth process, you're recording information in that subconscious. And some very gifted people have even found the root of some people's addictive behavior in like the third semester, you know, 3 trimesters when you're pregnant, but going way back into some early roots. So it's, I mean, you can really spend forever contemplating these things. And then you get down to your unconscious. And that is where Spiritists think we're carrying the roots of past life experiences, but we're also burying stuff. You know, like the stuff that was shocking or traumatic and maybe you were too young to know what to do with it. It had to go somewhere. And that's why in your dreams, sometimes material comes up and surfaces and you cannot even start to make sense of it unless you maybe keep a dream diary or you still keep working on the content. And just as Yasco said, it's not a good idea to repress things. And we're not saying that you shouldn't have anger, you should, but you really need to find a way to work it out so it doesn't just stay buried in you. And I think some of the most interesting understandings of illness were done in a cooperative relationship between Dr. Norm Shealy, who was the president of the American Holistic Medical Association, the first one. He teamed up with Carolyn Mace. She was a medical intuitive. She's written a couple of books. And at the end of the day, after Dr. Shealy had diagnosed some patients, and it was interesting, they seemed to group on certain days, like 3 heart problems or 3 breast cancers. He would consult with Carolyn Mace on the phone. She would go back and find the unprocessed emotional trauma. And it could have been at age 4. It could have been at age 11. And I'm not saying it was anybody's fault, because the family was coping, they were doing the best they could, but now we're getting smarter and smarter and understanding emotional intelligence, and we need to have tools to help young children express themselves. And if you're angry, you can do 3 laps. You know, you can punch a pillow, and then you can get to communication skills. So this is why all this newer positive psychology is so important, so that we're still growing up without creating a big baggage or trunk that we're carrying through. Eckhart Tolle was funny. One time, the Power of Now speaker said, by the time we reach middle age, you can't even get in the elevator because the baggage you're carrying that you have just stuffed away from all your earlier decades, you know, so. And then over here, just briefly with Carl Jung, you know, we again pretty much function every day as a conscious ego. We then put on what he calls the self-image or persona, which is kind of a mask that we do to be accepted in society. It could be the good girl, it could be the smart student, it could be the loving wife, and I'm not saying these things are wrong, but if you're burying your true feelings behind this persona or mask, it's a good idea to start like looking at it. You can just look at it yourself and know that it happens. Then we're into subconscious again, and then the shadow is a word he used where you put things, you know, the negative side. Although, as you understand, shadow and light balance each other. We're not just trying to get to pure light, we're just trying to shine the light on the shadow part so we can make friends with it. Like I think Ram Dass, who was one of my favorite spiritual teachers growing up in the 70s, said, invite your neurosis to tea. Just sit down on the bench and talk to your neurosis. Don't alienate it somewhere. As you make friends with things, and even as the Buddhists say, as you make your heart as wide as the ocean, you can hold anything in it. So that's really our journey now. That's true acceptance. And then we know from Jung's contribution, we're all male and female. You know, we tend to get culturally conditioned to certain expressions. But as women have entered the workforce, they've had to summon up their animus more. You know, look at Hillary Clinton. Look how tough she's portraying herself as somebody who can do the job. She still has her soft feminine receptivity. She just had a grandchild. But what she needs to do is to get her animus up and running. Just like men. Aren't we happier with men who communicate and show affection and don't just come home from work and go to sleep? I mean, that's part of the feminine side of the male starting to show up, because really our whole job is to balance and integrate all these different parts of ourselves. That's enough of that.
It was good. It was good. You're getting there. Yeah, very good. Keep talking.
This book was a gem, and you know where I found it for free? At Rusco Mansion, sitting on a shelf at our last fundraiser. And it was written by a local person, but we extracted just 2 tables from it because I think it gives us working vocabulary. And I love being able to name something. It gives me a false sense of control. If I can name what's going on, I just feel better. And then I can make a choice. But if I'm walking around saying what's happening, I'm not really very far into changing or healing myself. So here's the vocabulary. And we'll just say these people are all out there on the street right now. The first group with unconscious incompetence is that group that you scratch your head over at work and say, why did they do that? Like, it makes no sense. How could that person have chosen that? Well, we have to forgive them automatically because they're just not aware yet. They're just unconscious. They're acting out of their habits. They're acting out of something. But to us, it really looks like, whoa, something really isn't quite right here. Then we move on. I like this one, conscious incompetence. So I think we're all kind of floating around in the middle here. So, and this is where I say education's so important, because I just like people to take responsibility. Like if we know some food substance is really unhealthy, but we choose to eat it, then we made a choice. We made a conscious choice. So I would say if it was an unhealthy substance, we're demonstrating conscious incompetence. But you know, you're not in a fog. You can just say, I just kind of can't get over, like I have to eat this every day, or I have to drink this every day. And that's okay because you're conscious. I still think you're further along. Now this is where we like to think we are at conscious competence. You know, we're learning through Spiritism, we're learning through our choices, talking to friends, being exposed to healthy sources of information, and we're making good choices. But that's not where we stop. That was the interesting part to me. Our next evolutionary step is to get to unconscious competence. So that means it's so natural, kind of like a Mother Teresa or a Dalai Lama, that everything's just flowing out of you. You're never stressed, nobody really ever hurts your feelings, nobody ever lets you down, because you're so integrated, you've so evolved, you've changed your energy field, you're vibrating at such a nice level that everything is okay. It doesn't mean you're passive. You're still actively engaged in life, but it's not with the same wear and tear. Things aren't really stressing you out like they used to. So that's a nice model. I like we always say, we like to have models and goals and things to aspire to. So for the rest of my life, I want to become unconsciously competent before I pass on. And this is just a quick follow-up because Yasco's already spent time on this, but just know that if you spend too much time, one of the spiritual teachers I read said, you have about 7 seconds to be angry. But if you haven't discharged it within 7 seconds, it starts this biochemical trail. And then you are starting to change your biochemistry in your brain. So anger pulls that one up, panic pulls that one up. Ooh, hostility was the one that really impressed me. 35 different chemicals go off if you remain in a hostile mood. And then even negativity jumps your cortisol up. Okay. So where do all roads lead to? If we're going to become aware of our thoughts and change our thoughts, we've got to do a belief inventory. We have automatic beliefs that we act on every day. You might have gotten it from your family growing up. You might have gotten it from society, anywhere. You might have gotten it through reading. So our next step is to take a look at our beliefs, and that's why you have an exercise to do. And I think we're really going to only do this exercise and shorten this up because we can save the last third of our talk to another time because we always over-prepare. But I think having this belief inventory, if you don't mind doing it right now, and the way you do it is don't think too long. Just the first thing that pops into your head, fill it in. Did you not get one? You don't.
Can you just read the
Let me see.
Oh.
I'll read it. Yeah. Oh.
I can do it. If the people on the internet want to do it, if they can't read it, I'll say. The objective is to determine if the beliefs you hold are helpful or harmful. So 3 things you believe about yourself, just quickly. If we spend too much time on it, then your conscious mind is getting in there to evaluate. The next are 3 things you believe about relationships. 3 things you believe about money. You'll keep this private. It's not a paired exercise, don't worry. 3 things you believe about governments. No, it's all for you. Then 3 things you believe about work. Three things you believe about your...
It has to put as helpful or impacting?
We're not at that point
not
yet.
yet.
No, let's just brainstorm.
Okay.
3 things you believe about your ability. Three things you believe about your health. Three things you believe about your family. And the last is 3 things you believe about the future. Yeah, this whole talk will be available on the internet later. And this exercise will be posted when the talk is posted. So this then says go through and put an H for helpful or an I for impeding. Let's skip and just do an I. Skim through and see if you can find any beliefs that you just wrote down that you would consider impeding. That means getting in the way of like constructive growth. So see if you can't go through and just find one or two. We're not going to ask you to reveal them. I'll share what I found. I'm okay. I'm okay with my impeding beliefs and my helpful beliefs. Okay, so I'll reveal. Under family, I wrote supportive. This is my own experience growing up in my family. Individualistic, we all became, you know, self-starters, self-thinkers, but my third one was smothering. So an impeding belief for me is smothering. And again, families are complicated. Children get different perceptions, even from the same two parents that are parenting the same way, and that's great when they're relatively in cohesion. You can imagine the families where the two parents aren't a team. But it's just showing you that these things are going on. And then the other area that I had to take a look at was my belief about relationships. It's interesting because my chosen field is counseling and psychology. A lot of times I think you're drawn into the field you have the most to learn about. So I'm spending my whole life really looking at what creates healthy relationships, but I also am looking at my own life. So I have plenty of time to meditate on these subjects. So for relationships, I describe them as essential, heartwarming, and challenging. So challenging was my impeding belief, and maybe some people think challenging is okay. You don't want to be bored in a relationship. But if I chose the word challenging, I mean, you can see that really requires a lot more effort and work and like figuring it out. So this is just for you to take as a tool. I think it's, anyone think it was interesting to do? Yeah. Because we have to find ways to get from the science and the theory to practical application. Otherwise, it was all interesting, but what did I do with it? So I think what we're going to do, I'll consult with Yasco, is show these two slides, try to get to here and end, and not do the, and just go to the very last slide on prayer, because it's like 25 after. Why don't we save the prayer to another one? We'll go to Andy. Well, then you get up and do your own thing. Okay. This is a really short list. In fact, I originally had a list that was twice as long, because this is a never-ending list of things to do. If you really want to change your perception or become more of a happy, positive thinker, there are many different things to do. I selected two, which I probably can't go into today, but I can flash it up here. I have a handout on the emotional freedom technique, which we'll just pass around, because you can get it from the handout, and you can also go online and see a demonstration of it. But this was created by a man named Callahan, and what he found out is, let's say you're really down on something. It could be money, it could be one of the beliefs on your inventory. You have a way to change yourself beyond just saying, I'm going to choose a more positive thought. You can do this tapping sequence, but you also have to have an affirmation you're saying, and this is it. You would take middle and index fingers, you would tap 5 to 10 times on all these points. Even though I have this feeling like that relationships are challenging, I deeply and completely love and accept myself. I'm still okay. I have taught this to children. It's amazing because children and animals change faster than adults because they have fewer levels to get through. But if they do this tapping sequence when they have test anxiety or they have nightmares, it works. And there's something you can do. We always feel better when there's something we can do. So this is like emotional acupuncture. And this is just an introduction to it, but to encourage you to read the handout and maybe go online. Next. You just do the whole thing for me to shorten it up. Okay, this, again, we're not going to really spend time on. Maybe we'll put it in a future talk. But I wanted you to know, how many people have heard of cognitive behavioral therapy? 2 people, 3 in general. That's the most well-known therapy we have right now to change your thoughts. And once you change your thought, hopefully your behavior changes. But thanks to the mindfulness movement, we have now evolved into acceptance and commitment therapy. Because if you just take the first sentence, we need to accept our thoughts rather than going at it like it's a problem. Thought stopping is a word they use in cognitive behavioral work. There were even kids years ago who would wear like a rubber band or something. So as soon as that negative thought came into their mind, they'd snap it as a cue to drop the thought. And that's still being used. I'm not saying it's a bad technique. But wouldn't it be another level if you got kind of like that Buddhist model, your heart's as wide as the ocean, of accepting it through learning mindfulness practice? And mindfulness practice is really simply becoming an observer. So when you practice mindfulness meditation, you're not stopping your thoughts. You're actually stepping back from them and not getting caught up in them. So therefore, you're giving yourself some space, and you're developing the observer. The observer. The observer doesn't just react to life. The observer is a bit detached and has the time to make a choice. And this takes practice. When we talk about changing your habits and using free will and disciplining yourself, yes, in the beginning this is work. You have to practice it. It's not just a nice idea. But after you integrate the skill and it becomes part of you, wow, you arrive at a new place. And therefore it's not really the work that you took to get there. But I didn't want you to miss it because this is a newer version. Okay, and we can't do this talk without giving credit. Why don't you just do the whole thing? To Louise Hay, and I guess this must be a familiar book to people, Heal Your Body. Anybody ever use this book?
Oh, yes.
Okay. Why she's such a genius is in the back of the book, she's got everything you could ever have that's not correct in your thinking or your body. And she comes up with a probable cause. Like, let's take anxiety. Obviously, you're not trusting the flow and process of life. You have a negative kind of filter in your mind. You're getting anxious. What's your mind saying? It's not going to work out. It's going to be a failure. So what she suggests is you substitute that negative belief system with a positive affirmation. But we do know from affirmation work, it's not just thinking it. It's not just writing it. We've tried all these different methods. It's thinking, maybe writing, but feeling it. If you don't activate the fire of your heart and put energy behind that belief, even if you think you are pretending in the beginning because you're anxious, but as you practice, you will shift that pattern inside yourself. And what's the flu? We just went through flu season. It's buying into mass negativity and beliefs. Also belief in statistics. That's why sometimes watching the nightly news is dangerous, because you fall into groupthink. Okay, your turn.
Is this working?
Well, you want to take mine?
Yeah.
Okay, very quickly about, there is some magnetic passes that we do here that we can talk in another time. Spiritual surgery that the Spiritist Center, some John of God, for instance, he practiced this spiritual surgery, Reiki. But I want to talk more a little bit, these final slides, about prayer, intercessory prayer, because prayer is something that we learned since we were kids, but we say, is this really work? Scientists are the first not to believe in this, because we want to see there if this has some force. So, in this book, this Larry Dossey, he brings some situations, some cases where scientists prove that the power of prayer. So they put in a petri dish some fungi, very nice fungi, and then they put like a prayer, somebody praying over that petri dish, and really that pathogenic bad bad fungi start to slow down the growth in those that were prayed. People prayed over it. So they start to believe that was something, there is some energy that is healing. And also in plant seeds, I heard this in PBS the other days about this experience, that they pray over the water that they put over the seeds, and that receive the prayer, the seeds start to blossom more healthier and faster. So they start to believe that there is some magnetic force through the prayer, to the water, and to the seed. And in the medicine surgery, there's some interesting situation, like this doctor. Usually they are skeptical. Okay, doctors don't believe in the prayer. Most of them. So cardiac patients, they had much faster recovery. 5 times less antibiotics was needed. Less likely to have a pulmonary edema. AIDS, they were much faster, fewer hospitalization, shorter duration in the hospitals. And this group also, the catheterization, is very difficult to put some tubes to do some diagnostics, and usually has some side effect. They say, well, there was 100% few side effects in this procedure, imagine. So it works. I always say, I told you that I would pray for your doctor, for your nurse, for your technician to be in the best of their ability when they go to do surgery on you, right? Not for you to be in the best condition, but for the medical technician. In Buddhist and Franciscan nuns, also in our days we have this magnetic functional MRI, so they see difference in the areas of people that, like Buddhists and the nuns, during the meditation or prayer. So they have a real concrete result that was even photographed that showed that what the Buddhist monk say, well, I had in this ownness with the universe, and nobody understands this. Oh, but the MRI is showing this, that there is a difference. When the nuns say we have a encounter with God, I present, there is a change. And the Spiritism also says that prayer is a transmission of thoughts. It's an invocation by means of thought means enters in the communication with the being to whom he directed himself. Usually it's to the God. We may pray for ourselves, for others, and for the living and for the dead. So the Spiritists add this component because our health depends on the people from the other realm too. So we should pray for them too, right? And now we want you, everybody, to read this. Instead, we say our. So let's say loud this prayer by Mahatma Gandhi. So our beliefs become our thoughts. Our thoughts become our words. Our words become our actions. Our actions become our habits. Our habits become our values. Our values become our destiny. So we change our destiny. Thank you. Sorry for the wrong. 2 people, double your more. Thank you. You're very kind.
Thank you, both of you. We'll leave this up here. And perhaps it's not by chance, and the invitation already stays that we give continuation to this, right? Because there's much to learn. And I think it's true. Because